My name is Nick Iverson and I am an enrolled agent with Elevation Tax. The Affordable Care Act, also known as Obamacare, is a federal statute that was enacted in March of 2010, and it changed many aspects of our country's healthcare system. It had a number of components that affected United States tax law, including the medical expense floor for itemized deductions jumping from 7.5% up to 10%. There was the addition of the 3.8% net investment income tax, and high income earners saw an increase in Medicare taxes of 0.9%. But one of the biggest changes is the individual mandate, which requires most taxpayers and their dependents to have health insurance coverage or pay a penalty. Now, I said most taxpayers because some individuals are exempt. I would like to discuss what the penalty is for not having health insurance for the 2016 tax year, as well as some of the exemptions that taxpayers may qualify for. So, if you can afford health insurance but choose not to buy it, you must pay a fee called the Individual Shared Responsibility Payment. You will owe this fee for any month that you, your spouse, or your dependents do not have qualifying health care coverage, also sometimes called minimum essential coverage, unless you qualify for a health coverage exemption. A good resource is healthcare.gov. You can visit that website online and you can learn more about which insurance types qualify as minimum essential coverage, and you can also learn more about the health coverage exemptions. But in a nutshell, here are the exemptions. You are already covered by health insurance, maybe by your spouse or by your parents, or if you're a dependent for someone else, they may have you on their plan. If you are 65 years or older and have Medicare, you have coverage through the military, you have Medicaid. If your income is below the filing threshold, or if the lowest priced coverage available to you would cost more than 8.13% of your household income. If you participate in a healthcare sharing ministry, if you are incarcerated, if you are a member of an Indian tribe, or if you happen to be a member of Congress. If you qualify for an exemption, when you fill out your tax return, you will need to file Form 8695 to report your exemption. Individuals who do not have qualifying healthcare coverage and do not qualify for an exemption must pay the penalty. The penalty is calculated in two different ways, as I will illustrate now, and you will pay whichever is higher. So the first method to calculate the penalty is known as the percentage of income method. You will pay 2.5% of your household income after subtracting the filing threshold. However, there is a maximum amount, which is the total yearly premium for the national average price of a bronze plan sold through the marketplace. Now that is quite a mouthful, so it is on the slide for you verbatim. The second method is known as the per person method. The amount is $695 per adult, or $347.50 per child who is under 18 years old. The maximum penalty under this method is $2,085. Now, as a reminder, your penalty will be calculated using both methods, and you will pay whichever method yields a higher penalty amount. To illustrate, let's assume a single taxpayer makes $30,000 a year and has no health insurance coverage all year. He or she would get to subtract out the amount of the filing status threshold, and as a reminder, that is the standard deduction and personal exemption added together. And then they would multiply that amount by 2.5%. The result would be $491.25. In this case, the per person method would be used, and the penalty would be $695 because that is the greater of the two. Now let's assume that our single taxpayer makes $40,000 a year. Now his total penalty increases to $741.25. Since this amount is greater than the per person amount of $695, the penalty due would be the full $741.25. If you have coverage for part of the year, the fee is 1/12 of the annual amount of each month you don't have coverage. So let's assume the same facts as the previous example, except this time the taxpayer had coverage for 7 months of the year and was not covered for the other 5 months. The fee would be $309 using the equation on the screen. It's important to note that if you are uncovered for only 1 or 2 months, you will likely have no penalty, as there is a short gap of coverage exemption. If you have questions on the 2016 healthcare penalty or any other tax questions, please click here to schedule a free, no obligation consultation. For additional tips and tax saving strategies, be sure to sign up for our monthly newsletter and subscribe to our YouTube channel for weekly updates. If you have a question you'd like us to answer, please leave it in the comments below.